recent 4-year span, patients under the age of 20 years old diagnosed with type 2 diabetes has more than doubled. That was according to Maya Nelson, a writer on cancer research for the American Institute of Cancer Research blog on January 19th of 2017. I'm guessing that most of us in this room, when we think of a type 2 diabetic, you think about a parent, a grandparent, or an older relative or family friend. Although this may seem like the disease of an older person, people our age are still prone to getting it. Certain kinds of diabetes can be avoided or delayed. Today, I will first discuss the problem of type 2 diabetes, and second, how simple lifestyle change can be considered a solution. So first, let's begin with the problem of type 2 diabetes. Diabetes as a whole can be a very complex topic, but when it's broken into basic knowledge, it's easier to understand, such as what it is or what it entails, and the main reasons for getting this disease. Diabetes deals with the pancreas and the hormone it secretes, insulin. According to Monique Teo, a practicing physician at Massachusetts General Hospital on the Harvard Health blog on September 6th of 2018 stated that although this disease mainly impacts the pancreas, it can also affect your eyesight, your blood circulation throughout the entire body, and even if you don't manage it, can result in an early death for the individual. According to the Mayo Clinic, a nonprofit academic medical center used for educating and researching diseases, on their website, last updated January 9th of 2018 stated, type 2 diabetes mellitus is a chronic disease that affects the way our body metabolizes sugar. Our body needs the sugar we eat in foods in order to have energy to do basic essential things in everyday life. Which leads me to insulin resistance in the body and pancreas. Insulin resistance, as stated by the National Institute of Diabetes, Digestive and Kidney Diseases, a federal organization that educates and researches chronic diseases, on their website in October of 2009, stated insulin resistance targets the tissues that fail to use insulin effectively. This causes the pancreas to have an increase, trying to compensate for those failures in the tissues. Which leads me to the main reasons for having this disease. They usually go with the weight, the history, and the types of genetics. So for weight, it's pretty common for us to think about the overweight, medically obese individuals as having this disease. That makes sense, as the tissues that do not use the insulin effectively, that usually goes to become excess adipose tissue in the body. The excess adipose tissue in the body makes it harder for the insulin to reach all the cells in the body, therefore creating a harder time overall. Next, let's talk about the history. According to the Center for Disease Control and Prevention, otherwise known as the CDC, a health protection agency in the United States, on their website, last updated August 15th, 2018, stated that individuals with prediabetes or gestational diabetes usually have a higher risk for developing type 2 diabetes. Prediabetes is the informal wake-up call for the individual to realize that they need to change something in their diet or their exercise routine in order to actually effectively reduce the risk of getting type 2. Gestational diabetes deals with pregnancy, so women can only get this type of diabetes. Gestational diabetes is only the length of the pregnancy, but it can also have a higher risk factor for after their pregnancy is over. Which leads me to the final point of the genetics. If there's a higher risk in the family having this disease, there's a higher chance of the individual themselves to get it as well. Now that we have discussed the problem of type 2 diabetes, let's discuss the solution of a healthier lifestyle. A healthy lifestyle can be considered increasing their physical activity and also eating healthier. For physical activity, according to Sherry R. Kohlberg, an exercise physiologist, an expert in diabetes, and other authors on the Diabetes Care website on November 1st, 2016 stated, regular physical activity can reduce the risk of negative effects and normalize the blood glucose. Which makes sense, as insulin usually gets your blood pumping, and the insulin is in the blood, so the insulin can reach the cells effectively. According to Sherry Kohlberg, as cited before, and other authors in a different article she wrote for the National Institute of Health, on their government website on December of 2010, stated resistance exercise can decrease the risk of hypoglycemia. Hypoglycemia is when your blood glucose is below the normal that it's supposed to be at. Hypoglycemia can occur in any type of individual, with diabetes or without. Now that we've discussed what exercise we should increase, we can also just talk about the healthy eating patterns. According to the CDC, as cited earlier, they mentioned that you should always choose with the boiled or steamed foods rather than the fried foods. The fried foods add bad cholesterol for the body, which can turn into adipose tissue, causing a harder transition for the insulin. According to Monique Teo, as cited earlier, she recommends that you should always portion out your foods before eating them. This will reduce the risk of overeating and cause the body to help with the foods. She also recommends that you should have a balance between the food groups that you eat. And lastly, according to the CDC, they recommend that doctors and dietitians should be a big part of your life with making a food plan. A food plan will hold the individual accountable for what they eat and will help reduce the risk of overeating. Today I have mentioned the problem of type 2 diabetes mellitus, and second, how a healthier lifestyle can be considered a solution. Certain kinds of diabetes can be avoided or delayed. I'm guessing that all of you can at least make one change to your diet or exercise routine to help reduce the risk of getting type 2 diabetes mellitus in the future and reducing the amount of type 2 diabetes in the world we know today.